The hip surgery we did this morning was on a 78-year-old gentleman. And the conversation went, this pain has really gotten to the point where I can't mobilize, and the DA hip, or the direct anterior approach to the hip, is an excellent way to get somebody off of the table and pretty much out the door. You can walk on the same day, rehab them the same day, and get them going very, very quickly. And in a matter of weeks, they're pretty much back to normal. The beauty of it is that you don't go through any muscle, and you don't cut any tendon, you don't cut any ligaments. And that's because the hip is so close to the surface of the skin. If you go from the side or from the back, then you have to cut muscle, cut ligament. Whereas if you go through the front, you don't do that. Just go between the muscles, cut a little bit of fat, ligate one artery, and you're on the hip joint. So you can mobilize them very quickly and have a very low dislocation rate. We've actually extended the indications for a direct total hip both into the lower age group and into the higher age group. Most patients are on narcotics maybe a couple days, then they go on to a Tylenol, and they're essentially pain-free about into 2 weeks. It's a life-changing event. Total knees and total hips have a long, long survivorship. We're talking 20, 25 years. So it's a very safe, very, very effective, long-term solution to a problem that you don't need to hang on to. The most important thing for them to know is that I'm going to be there for them afterwards. My name is Daniel R. Cavazos, and I practice at Anterior Orthopedics and Sports Medicine.